Welcome, everybody. This session is on what does it mean to be career ready in behavioral health. We're going to let our speakers introduce themselves and then take it from here. Thanks for being here.
My name is Marlae Moss. I work for North Range Behavioral Health. I am the program director for our crisis services. So our crisis walk-in center here in Greeley, and then we have another crisis center down in the south end of the county in Frederick, and then our intensive care coordinators as well. So I did my master's degree at CSU, sorry, but very excited to be here, seeing this campus too. And I got my master's in social work, and then I had an amazing internship through that as well. And then, started with North Range soon after, and I've been with them for 3.5 years. Started as a clinician on the crisis team, moved up to the coordinator position, and then just became the director last winter, or I guess we're still in winter, earlier in the winter. And yeah, I got my LCSW. That's the other thing I did. I'm trying to remember and make this really nice for everyone, but I have had my LCSW now for about 1.5 years. So got all my supervision through North Range and everything like that.
I am Dayna DeHerrera-Smith. I did my undergrad here at UNC in Human Services, and then also did my grad program here through UNC through the Colorado School of Public Health at UNC, and earned my master's in public health in 2017. I was a Stryker scholar here at UNC, so I feel like it was coming right back into it, coming out of this building. I was just telling Marlae I worked in IT actually for 4 years at UNC, so was in this building a lot, much of my life. So I actually did my internships and practicums through Front Range Clinic. I did my practicum through Front Range Clinic on risk mitigation for MAP programming, and then I did my capstone with the Harm Reduction Action Center in Denver. I do not need licensure for my degree, but I am the business development manager for Front Range Clinic. I've been with Front Range Clinic since my practicum, starting as a administrator, moved into case manager, moved into office manager, and now I'm in my current position on the senior team. So that's kind of been my journey with Front Range Clinic.
Yeah. Our biggest plan with this was to just kind of, give you an overview of who we are and what we do, and then kind of just see if there's any questions first, but then maybe just run through some things that we found valuable, moving from, scary world of grad school or undergrad or whatever, and then moving into the career world. So we can start wherever. We can do questions first if there are any, or we can kind of start running down our list.
Okay. Well, I think one thing to start with, and maybe this isn't the vision of what the planners of this event wanted, but there is never 100% ready for a career. I truly believe that. You are going to learn the tools and the skills you need in your programming and in your schooling, and need to allow yourself some grace and flexibility for when you get into the career world. And no matter what job you go into, no matter what field you go into, there's always going to be an element of you kind of got to figure it out as you're there. You got to figure out the culture of the agency that you're working with, figure out the expectations of your role and the folks that you work with. I think collaboration is huge, especially in our world. Being willing, and if you hate your group projects in your classes right now, they just get better. You will always be working in group projects, and just being willing to be flexible and collaborative in your efforts. I would also say find somebody who does the work well and kind of stick with them and learn from them, learn how I think this was a big thing for me, and we'll get a little bit more into this, but with coping skills and burnout, behavioral health, substance use, they're really challenging fields to work in. And if you don't give yourself the space to leave work at work and have systems in place to avoid burnout, you will burn out. It's not an if, it is a when. And so finding folks that you can kind of mirror some of their boundaries and their coping strategies that they've set for themselves in this field, I think is a very good way to, I guess, protect the longevity of your career in behavioral health. The baby isn't necessarily being career ready, but being sustainable in your career as well.
Yeah, and just like Dayna said about, finding a person that you see doing it well, I think, when we were talking about presenting for this topic, finding an agency that you see doing it well, or that line up with your values, finding what you appreciate in a job, whether that's community or collaboration, or do you value doing work on your own or those group projects? Do you need a team? What is it that brings you to a job, regardless if it's in behavioral health or anything like that? What brings you to the job day in and day out? Find that and ask those questions when you're interviewing. Ask what kind of culture do you have here? That was important to me. What does supervision look like? Because I am really good on my own, but not at the beginning. So I ask a lot of questions. I need a lot of support. And when you're interviewing, it's as much for you as it is for them. If you're kind of not lining up with what they're offering or what their values are, it may not be the best fit for those kinds of reasons too, but preparing yourself as much as you can of what do you get out of a job, what makes you feel valued, what fills your cup in those ways, because it's a lot harder to do work for people or for a community that you're not kind of lining up with than a lot easier for folks that do. So,
for myself, when working with Front Range Clinic, my path was a little funny. I wanted to do substance use counseling, and then I realized that's not my journey. I'm not good with feelings. I don't really like talking to people. So why would I be a counselor? And so I switched to the prevention side of things. I really wanted to work in prevention, only to end up back in treatment in a different way. And one of the biggest values that I was seeking was harm reduction values. I had done my research on kind of the success levels of folks with abstinence-based only approaches and didn't love that. And that was part of what moved me towards the prevention world, only to find that there is this beautiful space of harm reduction for folks that can honor where they're at in their journey, but also continue to give them support to keep them healthy as long as possible. And for me, Front Range Clinic foundation was in harm reduction, and that was enough for me to say, okay, this is where I want to be, and this is where I want to do my work. So it may not always be something super definitive like that, but if you know there's a value that you have in this world, like Marlae said, it's worth bringing that up in your interviews, especially right now where it's an employee market, not an employer's market. I mean, you've got choices. Everybody and their mom is hiring. And, it's worth asking those questions so you can find a company that's an agency that's a good fit.
Question. You were talking about with other agencies, but your particular one that you thought field, how about law enforcement? Do you kind of collaborate with law enforcement as well? Yeah,
so I actually work a lot with law enforcement. I always tease that I spent the first half of my life avoiding law enforcement for some of the trickery that I got into, and have spent this part of my life actively seeking out law enforcement to work with. And it's been in the last 2 years, I've done a lot of work with with county jails and law enforcement in those spaces, specifically in rural counties. And it's been fascinating because I've been in this work about 5 years now. And 5 years ago, if you told me that I was going to be talking to lieutenants in rural county jails about how to implement MAP services and harm reduction practices, I would have laughed in your face. And now I'm doing that on a weekly basis, and just really working to move the needle on stigma. But there's also been some legislation that's changed that has really pushed rural county jails and law enforcement towards a harm reduction and treatment-based approach. Honestly, by dangling money. I mean, money speaks in a lot of these areas, and with that, having changed the legislation that limits the money that can go to agencies that are not doing this work, has opened up the door for a lot more conversations. And I think in that as well, we are seeing the jails that I've worked with are seeing positive effects of working with treatment providers. They're seeing less recidivism. They're seeing folks at least kind of move along in the stages of change in terms of readiness to seek support. And that has been, it's been amazing to watch. So, I mean, my job personally, I talk to somebody in law enforcement at least twice a week.
Also, along with that, about the homeless, there's a lot of people that are homeless that mental disability, I'm not saying everybody, but there's a few out there. Mostly nowadays, it's people that out there because they don't get enough money for a check or whatever. How do you kind of connect with the homeless that have mental disability?
I can speak a little bit to what we're doing. So Front Range Clinic has what we call pop-up clinics, which is where we're actually taking services into agencies that are serving those populations. So, for example, I've got a clinic that goes to the Aurora Day Resource Center down in Aurora. I've got another one that works with Farmers Farms out of Wellington. We have really close connections with Homeward Bound in the Grand Valley and Grand Junction, where literally we're going into shelters and day spaces and providing the services there on site in hopes to actually get folks connected to treatment in a space where they already have a good relationship and they've built rapport with that agency, being able to connect them there in that space. Because it is scary to say, I want you to go 4 blocks down to a space you've never been to meet people you've never met. It's kind of neutral ground to be able to meet those folks where they're at and get them started. And even if it's just a harm reduction conversation about what is your relationship with substances and how can we support you and making better choices, whatever that looks like, so that you can stay healthy longer.
Do you have any connections with military veterans?
That one is a harder one. I am sure we have that patience, but getting credentialed with the VA in order to provide services utilizing VA funding is a little bit more tricky. I know that we are recently able to accept Tri-West and TRICARE. So we're seeing that, but I will say that that's a population that I've struggled to kind of to meet where they're at in the same way.
Yeah, so North Range does a lot of the same stuff as well. So at Crisis, we're open 24/7, and a lot of the clients, so we see clients kind of all shapes, colors, all the things. So the youngest client I've ever worked with was 3. The oldest client I've ever worked with probably like in their 80s, and everyone in between. So we see homeless population is huge. A lot of adolescents struggling with suicidal ideation, adults struggling with substance use, and I mean a mix of everything. So we have done a lot. We work a lot with police as well, just at the walk-in center, but also we have a mobile unit where we can go out into the community and meet clients where they're at and meet them to help guide them through that mental health crisis. So we will do that with police a lot of times. We also have a co-responder program where a therapist is working with police and we'll go out with them to make that contact as well. And then a lot of our homeless folks, they will get into our program, our respite program, which is a transitional like 2 to 14 day program, and just gives them like a stable place to work on their mental health or substance use goals. Because we know Maslow's, if you don't have food, shelter, water, all those things, it's really hard to think about your coping skills. So we kind of provide that as well too. Other questions?
A question on the floor?
I have a question. So I know it was mentioned that like there's never you're never like 100% fully career ready.
Right.
But what would you say are things you can do at least to feel more confident in applying for that job or securing that job, or at least helping you like feel like a better candidate?
Yeah.
I'm assuming that you all have like at least a master's degree.
Mm-hmm.
Like, I'm also wondering, like, how did you all find that master's degree? How did you know which one was the one? What did you apply for that one?
Yeah.
Let's start with the master's degree question, because I feel like that's line up. So
Yeah.
I fell into my master's degree. Like I said, I was a Stryker scholar here at UNC. I'm a first generation student, so my family has never been to college. I did all that on my own and had no idea what grad school actually was. And then I had a lot of professors who were asking, what's your plan for grad school? Like, I don't know what you're talking about. Like, what is grad school? I thought I got the bachelor's and like we were chill and that's it. That was not the case. As a Stryker scholar, I was told there is funding to support your master's degree if you want to pursue it. If you leave and you don't pursue it, you lose that funding. So it was kind of a no-brainer. I needed to do something because I had this big pot of money available to me to actually pursue a grad program that I don't think I would have been able to do otherwise. And so I very quickly rushed into, I found out about this funding and applied for grad school within about a week and a half of the deadline closing for grad school. So I found the Master's of Public Health program here at the university. I found out about it through my professors through Human Services. And they were really almost excessive in their pursuit of me. And every time I saw them, they would be like, did you apply? Did you apply? Because I was putting it off because it scared me. And so when I finally did apply, I will say I did terrible on my GRE because I wasn't prepared for it because I applied so quickly. And I remember walking out of my GRE and having seen my scores and I was like, well, that's it. There goes that money. There goes grad school. It's over. And it was very reassuring when I talked to the folks in my program that they were like, that is just a tiny piece of the pie when it comes to your application for grad school. That was something I needed to hear because I didn't do well. It's very much about learning how to take the test versus actual content of the test, in my opinion. If I had practiced more, I think maybe I'd have done better. But so I was still accepted into grad school, even with a terrible GRE score, even with kind of not being totally prepared for that. There's things I probably would have done differently had I was preparing myself for grad school. So I think a lot of folks who are already thinking about grad school are probably 10 steps ahead of what I was, because it was a very fast decision and fast approach. And I'm incredibly grateful for what I did. And part of that I did, and part of the piece for me with the grad program was trying to find something that was versatile and could be used in a variety of fields and a variety of settings. I knew I always wanted to work with substance use, but I also know that I get bored quickly as a person, and I wanted to be able to move to different areas of work. And something like, for me, something that was more, concentrated in one specific field was not going to work for me. I wanted something that I can work in substance use for a few years, I can work in behavioral health for a few years, and then I can go completely on the other end and work in child and maternal health. I wanted something that would provide me a lot of opportunity to move around in my profession, and I think that's something to think about as well with grad programs. Is if you know that you're going to do the same thing forever, good for you. I'm happy for you. I'm proud of you. But most people are not like that, and I think I think generationally, we are a generation that changes careers often, and trying to set yourself up to be able to do that so that you have something that's transferable into multiple fields, multiple areas of work. So if you do get bored or you do get burned out, you're not completely leaving your degree behind. You can just transfer it to another area.
Yeah. I started, actually, I'm from Idaho, and so I did my undergrad in Idaho in social work, and then I have another bachelor's in photography, basically, because I was going to be a photographer. Changed my mind. And so when I was looking at master's programs with social work, there's a lot you can do with your bachelor's, but you can't do all the things. And while I enjoyed school a lot, I wanted to be able to get something that I never had to go back unless I completely wanted to change and like maybe teach. But I knew I wanted to help people. I thought, behavioral health is fascinating. And I knew that's where I wanted to be forever. So social work is super flexible because you can work with one-on-one, you can work in groups, you can be a lobbyist, you can work in the government, you can work in so many agencies. I think everyone has a social worker in some capacity. And so I chose my degree based off of my flexibility as well. And then as far as choosing a school, I looked at actually places who didn't need the GRE was part of my choice. So Colorado State didn't need one. I also applied to Portland State, with Colorado being my first pick. I went into the advanced standing program because I got my bachelor's in social work. So it was only a year, 3 semesters. It just really fit with where I'm at. I would say if you're having like a lot of options of where to choose, just ask questions of like, you know, what do you need to get there? And then like, if you're thinking about moving or staying, like those are things, I mean, you could go anywhere into any grad program. But yeah, I found something that was super flexible. I chose also CSU because it's generalist. So it's not specific on one type of social work. I didn't need to pick a specification. I can kind of just get an overview in anything. And that's also why I chose my job, crisis, because I work with so many different people. I see so many different things. So it's just about being like, flexibility is important to me. So if you don't need that, or if you like that, finding programs that suit that for you.
Your second question, because I do want to address that really quickly. I would say a couple of things. We were talking about this, like your social media presence does matter. Cleaning that up, making sure that you are presentable in that space, if not just deleting it entirely while you're job searching and changing your name. Because I can tell you, I have definitely looked at the social media pages of folks that we've hired. Going into an interview, actually looking at the agency's website and learning about what they do. I have been in a number of interviews where people had no idea what our agency did in the interview. And honestly, it was an automatic turn off of like, why are you're applying for a job that's very intense and works with a very specific demographic. If you don't know what you're getting into, you may not be successful in that space. And so really researching that piece. And then I would also say, you know, if networking is super important, you know, if you know that there's a specific area that you want to work in, are there spaces where you can come like this, right? And speak with people who are in this field who can talk a little bit about the agencies that they've worked for, the spaces they've been in, and just what to be prepared for. But you will learn as you go. And so I think that's, so we talked a little bit about imposter syndrome and challenging that, like you are here for a reason. You're in these spaces for a reason. If there's people in these spaces that don't look like you, that don't sound like you, that don't talk like you, then you're even more needed in those spaces. And making sure that you are like, part of what makes folks different is what makes them valuable to a company. If you've got the same people who all look the same, who all sound the same, who all have the same background, your agency isn't going to grow. Like we need that diversity and identify like what you bring to that table and don't keep it. Like be loud and proud about it.
And I think when we say you're never going to be 100% ready, we just mean like you should always just continue learning about yourself, about what you appreciate. And I was joking, like I have some ducks in a row, but some are off in the pond, and that's okay. You don't have to have everything together to apply or to, you know, apply to grad school or think about those options. So
if you look at a job description and you don't check off every box that's on that job description,
okay.
Apply anyway.
Yeah.
There are so many people who are underqualified who apply for jobs and get them every day. There's no reason you can't either.
Yeah.
You know, and you can even call it and say, this is an area that I would love to grow in and speak to that as well, because agencies are also looking for that. Like, I don't like to bring people into our agency who know everything and they're going to fix the world on their own single-handedly. We want folks who are willing to learn and grow and expand, because this field is changing every single day. And if you're not open-minded and willing to do that with the field, then you won't be successful.
Yeah. You both have questions.
Yeah.
So do you think, like, as far as like grad school, that behavioral health like services and facilities, would you say that, you know, they are more like versatile or like flexible in like applicants, saying as far as like what they do earn their like graduate school degree in or master's degree in, or do you think it's more like I guess, you know, like public health or like social, like just like those two?
I don't necessarily think so. I know, so I have on the team, we have people who have their masters in clinical psych that are actually getting their doctorate here at UNC. We have 2. We have clinicians who got their masters in counseling, in social work, in some variety of those kind of like helping behavioral health areas. I picked social work because I never have to change my degree to go do anything that I know I'll be interested in forever. But as far as like, you can do the same job with a variety of different degrees, right? Like we have bachelors in psych, we have bachelors in human services, we have just a lot of different things. So it's not just us. There's a lot of other options too.
And like behavioral health agencies are still businesses, right? So like an MBA is totally applicable in these spaces. And also I would say in my experience trumps what the degree is in. You know, if you have done a ton of work in this field, whether that was your internship, like during grad programs, I mean, if you know you want to work in behavioral health and you're in an undergrad, go find an agency that you can work as an administrative staff member. Like I said, I started as admin and moved to a senior team role. And it was my experience that pushed that along with the combination of having a master's level degree. But I mean, I see folks in our agency that have MBAs that have years of doing medical and behavioral health work that put them in an appropriate space to operate in our facility.
You know, you were talking about burnout. What would be some of the steps to help prevent burnout? You know, it's easy to do.
Their limits are, and rewarding yourself when you do those kinds of things, because it's hard, and just because you're not doing everything doesn't mean you weren't successful today.
For me, the biggest skill I could have benefited from an undergrad was self-care and boundaries, and putting those in place for myself. Again, as a first-generation student, I worked full-time through school, so like it was just 7 years of constant grind, like 60, 80-hour weeks, and I went right into my career with that same mentality, and it's not sustainable. So I wish in undergrad I would have practiced saying no more. I would have practiced taking some space. I mean, it got to the point where my partner was like, hey, if you don't put me in your planner soon, like we're gonna have a problem because I haven't seen you in 2 weeks and I live with you. And so
I have 30 minutes.
yes,
Where'd they
I have 30 minutes, yeah. So I think for me it was, I felt like I was really good at time management. I like to procrastinate, but I'm so good at time management, but didn't know how to say no. Was constantly, I mean, like working 3 jobs and taking 18 credits, and like that was the mentality I was in for so long, and I went straight into that in my career. And so just wishing that I would have practiced giving myself a little bit more grace in those spaces. I wish I would have enjoyed my undergrad a little bit more. Like I worked so much that I don't remember it very much. I just remember going to work and going to the dorms and back. And so, you know, I think that would have been helpful in my current world. Because it's like now I'm having to develop learning how to say no and learning to not take on projects and not being stretched as well.
So when you learn that, you teach us.
Oh man.
You might beat us there. I don't know.
Part of my book.
Yeah. What are some of the things that you can do with a bachelor, particular social work or psych?
Yeah.
I mean, you
You can do a lot. So bachelor's, I mean, I can speak to general. I know like case management, you can do with the bachelor's. You can be at North Range, you can be a behavioral health worker in any place, not just at crisis, but we have our residential acute treatment unit, our detox unit, all around the agency. We also just opened a position for bachelor's level counselors. So it's like an almost, I'm saying almost clinician because it's easier in my head. But gosh, yeah, anything like that in psych, in social work, sociology too. I think we're accepting some, just again, depending on your class load more so than, and your experience more so than just the degree. Because if you get like a bachelor's in sociology and a minor in psych, like that's awesome too. Gosh, yeah. So we have them on the crisis team as well as kind of throughout the agency too. So basically I'll speak to crisis because that's where I'm at. You would be doing safety assessments. So assessing people for immediate safety, any suicidal ideation, what that looks like. You would then be coming up with like, what's the next step? So what are we going to do to intervene in this crisis moment? Is that safety planning and going home? Is that setting up outpatient treatment, placement? You would be doing those kinds of assessments. They're like mini biopsychosocial. So like, let's start at the problem and work our way back to when this started in a very short window. And then you would also be provided extra supervision, at least weekly, with myself and then my coordinator as well. And then we're providing a like crash masters to like talk about diagnosis and things that you would get in a master's degree in a behavioral health setting, that we are going to kind of guide you through this and see if you want to get your master's, you know?
Is that something specific to where you're at, or is that something you've seen?
Yeah, so specific to North Range right now, I mean, the position just posted yesterday. But then with the bachelor's, I know there's a lot of places where you could work across the state, in residential treatment centers, in hospitals, any sort of, I think any behavioral health agency has bachelor's level positions. Yeah.
There's also a big push towards peer
Oh, yeah.
support
Oh,
as
yeah.
well. And peers are folks who have lived experience, whether that's with mental health, substance use
Mhm.
disorder. And that could be like your individual personal lived experience, or maybe, or someone who's immediately affected by you. So like if you were raised in a household with a parent who had severe and persistent mental health and substance use disorder, you could be identified as a peer as well.
Yeah.
That doesn't even require a bachelor's degree. Really, it just requires
Lived
lived
experience.
experience.
Yeah.
I know at our clinic, we have more bachelor's level and non-degree level positions than we do clinician positions, to be honest with you. We kind of have two sets. We've got, and I would say administrative work is direct patient care. Typically you are first line for patients in that space. And I think it gets overlooked a lot as not being direct patient care, but all of my direct patient care at Front Range Clinic was as an administrative staff member, and I loved it because I got to meet so many folks and I was still part of their recovery journey, even though I wasn't the medical provider or the clinician or the counselor. I did play a role in that, and it was important because I was the first person they talked to, and I was the first person they saw, and the last person they saw when they left. And my relationship and my engagement with those folks did impact their willingness to stay in treatment and continue to engage in treatment.
Does your organization, okay, let's say you work with somebody that is suicidal, and you seem like it was going good, and then all of a sudden they kill themselves. Do you have, and it's going to affect people, human. So in your agency's organization, to help the employee, how, and you have kind of a program to help that employee get through that? And,
Yeah, through in the benefits package, or just in general, even if you don't get your benefits through North Range, you qualify regardless of if you're part-time, full-time, whatever, for that kind of treatment through our employee assistance programs. Yeah, and then we also, I know like for law enforcement, we offer EMDR for like after they see something really traumatic, so that they can, you know, kind of address it and we can work through it and they can get back in the field, because that's ultimately what they want to do. So yeah, we offer a lot of different options for that, because unfortunately we see a lot of really heavy stuff, like Dayna was saying.
We offer that as well. And I would encourage just in general, anybody, if you're going into the behavioral health field, I feel like behaviorists and people who work in this field are the worst at taking care of their mental health and their behavioral health. And so being comfortable enough to speak with your supervising folks about, hey, this is where I'm at, this is the space I am, especially when that happens, because it happens, it's a matter of when, not if. Being able to speak that up and just be honest and vulnerable about kind of where you're at with your mental health, especially in those settings. Because again, we're all working in this field. So if we can honor our patients and how they're feeling, we can also honor our staff.
Yep.
Can you talk about experience you have had with a mentor? Talking about being career ready, how much did that help you and
Yeah.
how did you find that mentor?
Yeah, through internships, I know, I mean, you have to have some in your bachelor's and your master's, I think, at least for my programs. So bachelor's, gosh, I had an amazing, I was so fortunate with all of my supervisors, which is like super great, but I can't speak to like poor, poor supervisors. But my first one really just set up like ethical boundaries, and that's huge, because if you set them early and set them often, you usually don't have to worry too much. That was one of the biggest things I took from her. I think going into a mentor relationship, knowing like, and for me now, because I supervise, knowing how you learn and how you appreciate being supervised. Like if you need me to be available to ask questions, that's something we need to talk about first day, right? We need to set those expectations for each other. If you need what's your work love language? Do you need words of affirmation, or physical touch is always a no, but how are you appreciated, and how are you knowing you're doing a good job? What do you need in a supervisor? And having those conversations, I really like someone to, like I said, be available when I have questions, because I ask a lot of those. In my master's, I was actually set up with 2 different supervisors, because I did my internship through an agency, a nonprofit called A Face to Reframe, which was education in schools, mostly preventative, about human trafficking in Northern Colorado. So the direct supervisor didn't have the degree I needed, so I was hooked up with someone through the school that did. So I was again fortunate to have both, and those conversations were super helpful. Who do I go to for what? Just those expectations. And keep those connections, I would say, because I still talk to my supervisor in Idaho, and I just wrote a letter of recommendation for her. But I think it's so important, like Dayna was saying, networking, keep those connections, because you'll never know when you might need them, or they might need you. So yeah, I would say that expectations conversation was huge for me starting out.
One of my mentors is here at UNC still, and she was just in my corner. She's who pops up on my shoulder when I'm telling myself I'm not good enough for this position, I'm not good enough for this role. She's like, why are you saying that? And really, her biggest role for me in my mentorship was challenging the I want to use a word that I shouldn't use, the BS that I put on myself. A lot of my barriers are self-imposed barriers, and having somebody who would challenge that and make me actively say out loud, why are you saying you can't do that? And then I had to do that, and I was like, ooh, yuck, that was gross. Okay, and it helped me challenge that piece. I would also say some of my mentors that I've found are significantly older than me, which has been really nice, in that they have a lot more experience. And for me, I like to ruffle feathers, so when they give me advice, I don't always take it at face value, and I tend to push back and ask questions about why are you giving me that advice, and what are your experiences that have made you feel like that's the right answer. And that's been really helpful for me to just understand the thought process of that person and that individual, and why they're saying, why they're giving this recommendation or giving this support. So that, because I'm very much a why person, right? You don't just tell me the sky is blue and I'm like, cool, no, but why is it blue? And for me, that helps me internalize it a little bit better and be able to utilize it in practice more. Of okay, I understand what the intention is of this and where it's coming from, and I can use it in practice more frequently or more confidently.
What questions do you have? Great dialogue today. What else do you want to know?
I have a question. I don't know if it's specific to you or if you just generally know. What is a PSY?
Society?
Like PSY?
Oh,
Yeah.
I understand.
Yeah.
I don't know what it is, but I know I've seen it.
In what context?
I don't know. I advise students who are majoring in psychology.
Mhm.
And they tell me, you know, I ask them about their career plans or options, and they tell me that they want to cite.
Like a doctorate in psychology, I believe what that is.
Oh.
That's where I go in my head.
Okay.
I mean, I would just in general with doctorate degree, I feel like the best advice I got from my mentor was like, don't go into a doctorate degree until you are 100% sure that that is
Yeah.
what you want to do for a very long time. Like she really, I had an opportunity to go directly into a doctoral program, and she actually deterred me from it and saying that like, really what you're doing. So like my path is I would have gone from a bachelor's to a master's to a doctoral degree with not a lot of career experience in between. She said, she's like, the doctorate degrees are always going to be there. They're always there to go back to, but like you want to come back to it because especially with the doctorate, you have a thesis and that's what you work on for 4 years. Like you pick one thing that you study and research and dedicate your life to. Like, don't you want to have some experience before you pick what you're dedicating your life to? Because you may get out into the field and find like, this is not the population I want to work with. This is not like, this is too challenging or maybe just like not as fulfilling as I thought it would be. You just spent 10 years of your life dedicating to that. So, I mean, I don't know if that doesn't answer your question necessarily, but
So tell them no.
yeah.
Just kidding.
I mean, I think it's valuable unless you have somebody who is going to pay for your school immediately and you lose that if you walk away. I think it's super valuable to leave the academics for a while and be in the field and like play around for a little bit. You might actually meet folks too that like are using their psyche for something entirely different than you ever thought was even possible, or have some entirely different degree that's much more in line with the work that they actually want to do.
So it is a doctorate
I
in
think so.
psychology.
I'm pretty sure.
That's what I hear when you
Okay.
say that.
But yeah, that's really helpful, and I think that there's this, I don't know, there's this thought that like as soon as you graduate from high school, you have to go to college. As soon as
Totally.
you graduate from college,
Yep.
get your master's, and like, it's really important that students know.
Yeah.
Take a break, take some time
Get
off,
your
do some
hands
other
dirty
work,
too,
like,
get experience.
Get in there.
And I think do what feels best to you. Like I went straight through, but it was because I knew if I stopped, I probably would never go back. But I don't think there's not one right way to do it. And I think that's the pressure to go straight through. I don't think we need that because you're not going to lose it. It's always going to be there. Go get experience in doing what you're doing with your bachelor's, or even without a degree, go.
You might get the
Work
dream
and-
job you want without the doctorate, without the $100,000 of debt.
Yeah.
Like,
Somebody on the chat mentioned it wasn't like as far as I know, it's like you have a doctorate degree in psychology, the focus is more on applied psychology and less on psychological.
Oh, nice.
helpful. Thank you.
Thank you.
Yeah, I've learned in life, in a lot of areas, I'm not talking about your area, in a lot of areas, people go get, bachelor's or whatever degree, and experiences and training is the key right there in most cases, with exceptions like doctors.
Yes.
But in most cases, you really don't, no offense, but don't need a college education. If you
Yeah.
get good training and experience, that's the best education.
Yeah. And I think at a point, you may need the education. Like I know for hiring purposes, like if I'm looking at people, like sometimes we have to have, like, so one of the people that is getting their doctorate here at UNC, they went straight from their bachelor's and are getting their master's with their doctorate, but they never stop at one point and say, I have my master's. So unfortunately, they can't be a clinician. So even though I know that they've done all the things, it's just our requirements. And so I think at some point, if you want to do the thing, see what you need to do the thing. I know that sounds really professional. But
And find somebody who's doing the thing.
Yeah.
Because they may have had a totally different path. that is
Absolutely.
Maybe not easier, but
just different.
different.
Yeah, there's not one way.
We want to make sure you guys have plenty of time to take a little break. Any final questions or thoughts you want to throw out before we adjourn?
If there's anyone who ever has questions about crisis things or whatever, I'm available. I have kind of a busy schedule, but I like to make time. So if there's anyone that wants to set up time with me or call me, pick my brain, I'm happy to have those conversations. I have my card. The number is not right, but my email's on there. So let me know if anyone has any questions or anything like that after.
Thank you.
I
Thanks
have
for
my
being
cards here as
available.
well.
Excellent, great. Thanks for the engagement, great questions.
Yeah, thank you guys.
Thank you very much.
Thanks.